So after about 20 years of studying the Vedic sciences, I decided to go back to school for clinical psychology and get a PhD. And it's been wonderful to do that study with my Vedic education and to be looking at everything that I'm learning through that Vedic lens. So today I'm going to be talking about qualitative research on Prajñāparādha. And relative to there's so many different types of research, and two big divisions of research are quantitative and qualitative research. And so to just give you a taste of these two different types of research, I'll give you the results from each. So the results from a quantitative study where virtual reality was used to treat PTSD, one of the results was that there was a 34% decrease on clinician-rated PTSD. 34% decrease. Now, when we look at qualitative research, the result of a qualitative research gives us something that looks like this. Miss A went on to say, I tried just noticing the sensations in my body in class. I slowly learned to just have my feelings without being hijacked by them. I am more present in the moment, and I am more tolerant of physical touch. I can finally feel intimate with my husband. So this is from a study for yoga therapy for PTSD. And we can see that these are very different learnings that we get from these two types of research. One is giving us a number, it's giving us numerical data, and it's giving us a very hard result. So quantitative research is result-oriented. Now when we look at qualitative research, it's more process-oriented, and it's looking at what's happening, what's going on inside, and it's trying to get an insight on what's the process that's happening. Now, quantitative research, it's looking at a particular, and a particular in a very particular context. And in that particular, there's a blind that's beneficial for getting that numerical number. When we look at the qualitative research, we're looking at the whole in the context that it's in. And it's the opposite. We're not going blind, we're actually training the researcher to be a very detailed observer of a particular level that's being researched. So very different types of research. Now, one is not better than the other. Both are very important. But what's happens in the West is quantitative data is given a lot more importance because it's considered more objective. And there's a lot of debate that there's a lot of subjective variables that come in very unconsciously. When we look at some of the research that's being done with yoga therapy the last 5 years, a lot of this research is both quantitative and qualitative, and it's really beautiful. Now, when we look in the mental health field, the qualitative research is extremely important. When we're just talking about physiology, it doesn't have the same importance, but when we enter the mental health realm, it becomes very crucial. And for example, if there is a depression study for 6 weeks, one group is given yoga therapy, one group is given a antidepressant. That antidepressant group, they might show a huge reduction of symptoms. But when we look qualitatively, we get results that look like the difference between I slowly learn just to have my feelings without being hijacked by them. I am more present in the moment. Compared to the antidepressant group that said my depression is gone, but I feel numb and unable to enjoy anything else in my life. But I am afraid to stop taking my medication because of the withdrawal, and I'm afraid of the anxiety coming back. So even though one had a reduction in symptoms, we see there's a vast difference in what was actually experienced. So for the future of Ayurveda, it is very important that we bring in this qualitative element into our research. Now, in the realm of qualitative research, there are different forms of qualitative research. And my research has gone into the phenomenological realm. And the reason for this, well, one is a lot of the yoga therapy work that's being done is promoting phenomenological qualitative research. And when we look at this, they're looking at examination, examining the characteristics that are going on, which are very similar to pariksha, lakshana, upalakshana. Everything that we use in Ayurveda are being very much promoted in phenomenological research. Now, there's a few different methodologies in phenomenological research. And the two that I've seen that correlate best with Ayurveda is one called ecological phenomenology, which recently there was a book by Chakravarti Ramprasad where he compared Charaka Samhita and showed that this is the view that Charaka is actually speaking from. And it's comparing the phenomena of a human in relation to its physical and social environment. For my research, I'm using something called embodied phenomenology, which has to do a lot with embodied cognition. And this morning, for all those who were at the opening lecture, when Dr. Suhas was saying that, you know, our whole body is thinking, there's nerves everywhere, there's neurotransmitters everywhere, and so embodied cognition is taking into account this entire full body cognition. Now, my research is in the realm of trauma and Prajñāparādha. And trauma has become a very hot topic in the world of psychology. And where does trauma fit in Ayurveda? It's not something that's being talked about too much, but it is. Charaka knew everything. And but in order for us to understand the Ayurvedic approach to trauma, we have to first understand a little bit about how the West is measuring trauma, and then compare that to what Charaka is telling us. So one of the scales for trauma is something called an ACE score, ACE, which stands for Adverse Childhood Experiences. And this first came about by a study by Kaiser Permanente, where they had 17,000 patients, and they compared their health history with a test that put them on a 1 to 10 scale of adverse childhood experiences when they were young. And they found that the higher that ACE score, meaning the more adverse childhood experiences, the higher the trauma score, the more likely they are to have a physical or psychological disease. Since that study, there's been a number of studies done that have directly correlated high ACE scores to autoimmune disease, cancers, COPD, alcohol abuse, sexually risky behavior, depression, suicidality. Some of the studies are as high as an 80% correlation. People suffering from some of these situations have an 80% chance to have over a 6 on their ACE score. So it's a pretty direct correlation. Now when we look at Charaka Samhita, Charaka, when he talks about Prajñāparādha, he gives us 2 clues. And one of them is he describes how somebody who has Prajñāparādha is acting. And he talks about them being overstimulating and suppressing the natural urges. He talks about them having reckless and violent sexuality or excessive, breaking the rules of decency. All the activities that he's saying that people with Prajñāparādha do are things that psychologists have found people with large trauma histories are doing. And so there's a direct correlation between what he's listing as Prajñāparādha symptoms or activities in these people and what we find in people with a trauma history. Now, if we look at another area, Charaka, he gives the external causes of Prajñāparādha. And he lists them as humiliation, injury by a weapon, assault, bondage, rape, harassment, all things that we know are trauma-inducing. So he tells us that the external causes for Prajñāparādha basically are what we in the West now call trauma. And so if this is what's causing Prajñāparādha, then if in the West we can measure the trauma, we have a trauma score, then why not in Ayurveda do we not have a way to measure Prajñāparādha? And why aren't we talking about it more and understanding it more? And so what I first started to do is I went through all the texts and I really studied very deeply what was being said about prajna and its aparādha. And can it be measured? And when we look, Charaka is giving us lakshana. He's given us direct lakshana that are observable, which means it is something we can observe, thereby we can measure it. And then I asked myself, so if there is this correlation, what is it when people have a traumatic situation, what are they losing? Because Prajñāparādha is this loss of prajna. So what is it that they're losing? And there's a few things that they're losing, and one of the big things that they're losing is awareness of their body and awareness of their embodied cognition. So my research at the moment is studying in people with trauma this loss of their embodied cognition and comparing them to people without trauma who have a regular yoga practice where they're getting in touch with their body. And so I'm just going to give a little example of some of the things that I'm doing in my research. I'm comparing people that have a high A score to people who have a low A score and a yoga practice. And so I'm just going to give an example so that we can all experience. So if you just take a minute and be aware of where your body is right now and how your body's feeling. Quick check. And now if we bring into your mind a memory of a time where you were really angry at somebody. Really angry. Think about what you were saying, what they were saying, what it was that got you really angry. Now, what are you feeling in your body when you check in? Take a minute to just go through a body scan and notice what's going on. So, people with a low A score in a yoga practice, they will often say to what we just did, that they experience tension in the shoulders, or heat in the face, or clenching of the fists, or maybe a squinting of the eyes. They will have a body experience. They will feel that their body altered by having this memory of something that was angry. Where people with a high A score, they get triggered and they start re-experiencing the situation that they were angry. And we could call that smriti bhramsha. The memory is, they get stuck in the memory instead of the present. They start speaking as if that negative situation is right now. They've lost their focus. They aren't focused on what you were talking about or what the present is. So it's a driti bhramsha. They are not aware of their body sensations. They're unaware, this is called vedana. They're unaware of what's happening in their body. They've been hijacked. And they're unable to calm their body mind and come back to what's happening in the room, which is a type of de-bhramsha. So looking at this, there's this direct correlation with trauma, and my research, which is happening at the moment, is looking and really trying to find a way that we can, well, I should say, first, it's tying together that we can measure this Prajñāparādha. And then, if we can measure the Prajñāparādha, how do we measure it? And how do we get a scale of what is this prajna and how much is it missing? And what do we need to do to restore this? All right, thank you.
That was a wonderful presentation. Once again, another aspect to research, wherein now he's talking about freedom is talking about actually using experiences and their personal interventions on people, all right? And then he's taking a situation where we talk about, failure of the intellect, or here in this case Prajñāparādha, and he's comparing that with trauma. So, this kind of research is something which, it may seem very complex, but it is doable. And of course, on behalf of everybody here, I'd like to, wish freedom the very best.